Now to a big deal for little kids and a lot of relief for many parents out there. Children 6 months and up can now be vaccinated for COVID after the CDC recommended Pfizer and Moderna shots for babies and toddlers.
Now, Pfizer requires 3 shots, Moderna only 2. And pediatrician and infectious disease expert Dr. Dean Blumberg from UC Davis Health is joining us now.
Dr. Blumberg, good to see you as always. You know, a lot of parents at this point seem to be taking a wait and see attitude about these shots. So what do you say to those parents who are still on the fence, still concerned about getting those tiny humans vaccinated?
Yeah, it's important to know the numbers and know what the risk is. And so it's many parents don't realize that 485 children less than 5 years of age have died from COVID. And that puts it into one of the top 5 leading causes of death for that age group. We also saw a 5 times increase in admissions, hospital admissions for this age group during Omicron, and 20% of those kids ended up in the ICU. So although it's less severe in this age group, it can be quite severe and it can even lead to hospitalization and death.
So you gave some of the numbers there, but I mean, it's taken so long to get this approved. So many of these young kids have actually had COVID. So if they've already had it, should they get the vaccine?
You know, having COVID gives you some protection, but that protection wears off after about 3 or 4 months. So it's safer to be vaccinated and boost up that protection to make sure that people are protected against getting disease, against getting severe disease, and possibly transmitting to others.
We know many adults have had some side effects, especially after that second shot and even the booster. A lot of parents concerned about the side effects for their little ones as well. Are there any for younger kids who get the shot?
You know, it's very similar to older children and adults in that it causes fever, pain, redness at the site of injection, and this generally goes away in a day or 2. There were no unusual side effects that were seen during the clinical trials.
All right, let's talk about the rest of us. You know, the vaccine, a lot of us, the booster, we haven't had one in 6 months or more because it was the fall when we were getting the booster shot. So how concerned should we be with these variants that we're not protected?
Well, the Omicron wave hit us really hard, and many people got infected during that wave. But then that did decrease for a while, but rates have now increased. So they're about 8 times increased since the beginning of April. So there's a lot of transmission that's going on. People are going to be vulnerable to disease, even if they got infected in Omicron in January, because that protection's likely worn off. So I would encourage everybody to be fully vaccinated to get their primary series as well as all the boosters that they're eligible for.
And going back to the kids, Dr. Blumberg, any preference, Moderna versus Pfizer? I know some parents are more concerned about stretching the doses out to 3 versus 2. Do you recommend one over the other?
Yeah, you know, the Pfizer is 3 doses, and that's because the initial 2 doses didn't result in a good enough immune response. It's hard to bring back kids for booster shots to make sure that they get all those doses. So if they want to get more convenient shots, then choose the Moderna if that's available, because that's only 2 shots, whereas the Pfizer is 3. Otherwise, there's no appreciable difference to date in terms of side effects or protection between the 2 of them.
All right, so you're looking to get a young kid in there under 5 years old.
Yeah.
What's the best way to have that talk with them to prepare them for what's to come when they go in there and get that shot?
Well, they're already used to going to see their doctor, and they're already used to getting other childhood vaccinations. So it'd be similar to them to prepare them for it. Don't lie to them. Make sure that you're telling them the truth. And, you know, I like to tell children that it's going to hurt. It's going to hurt like a pinch, and you can even demonstrate by, you know, pinching. But I think that it's something that you have to be honest with kids and not lie to them about.
Yeah, maybe some ice cream as an incentive after the fact
That's
is always
a good
way
idea
to sweeten the deal.
Hey, bribery goes a long way when
Just
it comes to
saying,
that.
it works.
All right. Dr. Blumberg, thanks so much, as always, for joining us this afternoon.
Thank you.